All right, so today we're taking a deep dive into something super important, but often pretty confusing, female hormones. We're going to break it all down no matter where you're at in life. Like, did you know that even just not getting enough sleep can totally mess with your hormones? That's the kind of thing we're going to explore today, those little things that can make a huge difference.
Yeah, we're really going to try to make sense of it all. And we have a fantastic guide for this, Dr. Sara Gottfried. She's like the ultimate expert in this area.
Totally. She's got this amazing background. She's an OBGYN, but also, get this, she has a background in bioengineering, and she went to Harvard Medical School.
Wow.
So smart. And now she's a clinical professor at Thomas Jefferson University, specializing in integrative medicine and nutritional sciences. She's been doing this for over 20 years, helping women live healthier and longer lives.
It's incredible. Her expertise is so broad. She looks at everything like the traditional medical stuff, but also the impact of nutrition, supplements, and even just changing your lifestyle.
Mm.
And she's even starting to work more with men's health too.
Oh, that's interesting. Well, today we're going to uncover some really crucial and maybe even surprising connections. Like, for example, did you know that the bacteria in your gut, like trillions of them, can actually affect your estrogen levels?
Yeah. And we're also going to dive into what specific nutrients women really need, like omega-3s, and the best exercise mix for your hormones.
Mm.
We're even going to talk about something a lot of women struggle with, digestive issues,
Hmm.
and how it can be linked to hormones.
Right. So many women deal with that. And we'll try to make sense of all the different hormone tests out there so you can decide what might be right for you.
Definitely. And, Dr. Gottfried's written some awesome books on this, like Women, Food, and Hormones, and The Hormone Cure.
Yeah. I found the hormone cure especially helpful for understanding how all the different hormones, like, talk to each other, Like,
Yeah.
it's all connected.
The whole system.
Exactly. So let's start this journey through a woman's life, looking at all these key health things through the lens of hormones. Let's kick things off with the teenage years. Puberty.
Yeah, puberty.
Even if you're, like, way past that stage, getting these hormone basics down is so important for understanding health throughout life.
It's like the foundation. And it's interesting, Dr. Gottfried pointed out that the age girls are hitting puberty is actually getting younger. She thinks it might be connected to things in the environment and even, get this, stress levels.
Whoa, stress impacting puberty. That's kind of wild.
It is, right? So let's break this down. When you're a teenager, your body's main hormone control center, it's called the hypothalamic pituitary adrenal gonadal thyroid gut axis. It's a mouthful, right?
It's a mouthful for sure.
But basically, think of it like a complex network, like a bunch of computers that control everything from your stress response to reproduction and metabolism. And when you're a teenager, some of those connections are still being formed. They're not quite there yet.
Okay, like the wiring is not all hooked up.
Exactly. And that's why things can be a bit unpredictable, like with periods. Teenage girls might have irregular periods at first. And skipping periods, especially when stressed, is pretty common during these years.
Makes sense. So what should we be paying attention to during these years?
Well, instead of getting caught up in the estrogen and progesterone levels, which can fluctuate a lot during those early years as cycles are getting established, Dr. Gottfried suggests that cortisol might be a better thing to watch.
Cortisol, the stress hormone.
Yep. It can tell us a lot about how the body's handling stress during this crucial time.
Interesting. And, this makes me think about birth control for teens. Dr. Gottfried actually has some pretty strong opinions about that. She even called oral contraceptives, the pill, potentially the #1 iatrogenic endocrinopathy for women.
Whoa. What does that even mean?
It means a hormone imbalance that's caused by a medical treatment. So basically, she's saying that the pill, while it has its benefits, can also mess with your hormones.
That's something to think about for sure.
And this leads to another option she's a big fan of, the copper IUD. It's non-hormonal and has incredibly high satisfaction rates, plus it lasts a long time, like up to 10 years.
Wow, 10 years. That's amazing.
Yeah, it's super effective, but what's interesting is that it's not as widely used as you might think. Dr. Gottfried talked about how old-fashioned ideas kind of discouraged women from using it if they hadn't had children yet, which thankfully is changing.
Good. So moving on, let's talk about the 20s. Dr. Gottfried says this is the prime time to figure out your baseline hormone levels. Estrogen, progesterone, and testosterone. It's like getting a snapshot of your hormonal health when things are, relatively stable.
Yeah, like a reference point.
Exactly. And the key thing to understand here is the balance, the back and forth between estrogen and progesterone. She calls it the tango. Problems can pop up when estrogen starts to dominate, which could lead to things like fibroids, endometriosis, or breast pain. And get this, it can be linked to the estrobolome.
The what?
Yeah.
Estrobolone, that's a new one.
Right. It sounds complicated, but it's basically all the bacteria in your gut and their DNA that can actually change how much estrogen your body has. There's this researcher, Martin Blazer, who's doing some fascinating work on this. He's found connections between problems in the estrobolome and a higher risk of estrogen-related conditions, not just for women, like with breast and endometrial cancer, but also men and prostate cancer.
Wow, so gut health is super important for hormone health, too. That's a connection I didn't really make before.
It's huge. And that's why getting those hormone levels checked in your 20s is so important.
Okay, so what tests should we be asking for?
Well, besides the basic estrogen, progesterone, and testosterone, Dr. Gottfried also recommends checking DHEA, which is like a building block for other sex hormones, and estrogen metabolites. That tells us how your body is breaking down estrogen. Is it going down the good pathways or the potentially harmful ones?
That makes sense.
She also suggests doing a stool test to check out your gut microbiome, specifically looking at something called beta-glucuronidase. This enzyme, if it's high, means your body might be reabsorbing estrogen instead of getting rid of it, which can contribute to that estrogen dominance we talked about.
Okay, so lots of tests to consider. And if someone's in their 20s and wants to get these hormone blood tests done, is there like a best time during their cycle to do it?
Oh, good question. For someone with a typical 28-day cycle, Dr. Gottfried suggests around day 21 or 22. If your cycle's shorter, you'd adjust that a bit. While blood tests are the usual go-to, usually covered by insurance, she mentions some other cool options like dried urine testing.
Dried urine.
Yeah, it gives you a more complete picture of how your body's processing hormones over a whole day, not just a single moment in time.
Oh, that's interesting. So blood tests are like a snapshot and urine tests are more like a movie.
Exactly. And then there's saliva testing for cortisol to check how much of the active stress hormone you have. So it really depends what kind of information you're looking for.
That makes sense. And what about nutrition in your 20s? Should we be looking at that too?
Definitely. Dr. Gottfried really emphasizes getting nutritional testing done during this decade. Those micronutrients are so important for both making hormones and getting rid of the ones we don't need. For example, magnesium is really important for how your body processes and eliminates estrogen. She recommends doing both blood and urine tests to get a full picture.
Okay, so blood and urine for nutrition. Got it.
And she also highlighted this really important connection, which is that eating lots of veggies, especially the colorful ones, and foods high in polyphenols can actually lower your risk of breast cancer.
So eat the rainbow. That's pretty straightforward advice.
It is. And speaking of things everyone's talking about these days, what about probiotics? Should young women be taking those over-the-counter probiotics?
Yeah, it seems like everyone's on the probiotic train these days.
It's definitely a trend, but here's the thing. While probiotics are popular, the really solid evidence from large studies to support everyone taking them all the time, it's not quite there yet. Dr. Gottfried said they might be helpful in specific situations, like for athletes who might have a leaky gut, or after you've taken antibiotics, to help your gut bacteria bounce back.
Okay, so maybe not a must-have for everyone.
Right. And she pointed out that the research on prebiotics, which is what feeds the good bacteria you already have, and using polyphenols for gut health, that research is actually a lot stronger right now.
Interesting.
But ultimately, her best advice is to just eat more veggies. That's a great starting point for a healthier gut microbiome.
Solid advice. What about those at-home gut microbiome tests that are popping up everywhere? Are those helpful for getting personalized dietary advice?
That's a really good question. The thing is, while we know having an imbalance in your gut bacteria isn't good, and that having lots of different types of good bacteria is generally good, we don't really know the ideal ratios of all those different bacteria yet.
Okay, so it's still early days for those tests.
Yeah, pretty much. So it's hard to get really personalized and helpful recommendations from those tests right now. Maybe in the future, though.
Fingers crossed. Let's circle back to nutritional testing. You mentioned it gets pretty detailed. What kind of stuff are they looking at in those tests?
Oh, all sorts of things. A comprehensive panel might measure antioxidants, like vitamins A and C and alpha-lipoic acid, and also antioxidants from plants. It checks your B vitamins, which is super important because some people have genes that make it hard for them to absorb those properly. They also look at glutathione, which is key for detoxification. And of course, minerals, with magnesium being a really big one.
You mentioned magnesium deficiency is pretty common, right?
Yeah, it's estimated that something like 70 to 80% of Americans don't get enough magnesium. And Dr. Gottfried, she often uses labs like Genova Nutrivol Metabolomics and SpectraCell for these tests. Sometimes insurance even covers the Genova ones, which is awesome.
Good to know.
And to get the most accurate read on magnesium levels, she really emphasizes checking the magnesium inside your red blood cells. That gives you a much better picture of how much your cells are actually getting compared to just looking at your blood serum levels, which can be all over the place.
Makes sense. And this actually connects to something else you talked about, constipation, which, let's be real, is a pretty common problem, especially for women.
It is. And what's fascinating is that women get constipated way more than men. Dr. Gottfried talked about a bunch of possible reasons for this, like diet, stress, and this really intricate connection between the mind, nervous system, immune system, and hormones. They call it the psychoneuroimmunological endocrine network, or PINE for short.
Pine, like the tree.
Huh. It's easier to remember that way. But yeah, it's all connected, your thoughts, your nerves, your immunity, your hormones. If one part is off, it can affect everything else. And she even touched on this idea that in some ways, being female is a health hazard.
Whoa, a health hazard. That's intense.
Yeah, I know, but she's referring to the fact that women have higher rates of things like depression, insomnia, MS, and thyroid issues.
Oh, okay, I see. It sounds like a really complicated mix of things.
It really is. And then you add in the anatomical differences. Women tend to have longer colons, which can be kind of twisty. Dr. Gottfried even questioned if the standard medical definition of constipation, which is going less than once every 3 days, is actually a good enough definition.
Really? So what does she think is a better way to define it?
Well, she says a better way to think about it is, do you go every morning, and do you feel like you've completely emptied your bowels? She also talked about the balance in your autonomic nervous system. You've got the parasympathetic side, which is all about rest and digest and pooping, and then the sympathetic side, which is your fight or flight response. When those are out of balance, it can lead to constipation.
So it's not just about what you eat.
Right, and she even mentioned that there might be a connection between women who have experienced trauma and physical symptoms like constipation, like the body's holding on to things emotionally and physically.
Wow, that's heavy. So what can women do about it?
The recommendations are pretty straightforward, like increasing fiber intake, but also, really importantly, working on reducing stress. But Dr. Gottfried emphasized that it's not just about having less stress in your life, it's about how you perceive stress and how you react to it.
So it's about managing your stress response.
Exactly. It's about finding the tools that work for you. She mentioned this cool breathing technique called physiological sighs, where you do 2 quick inhales and then a long, slow exhale. There's research from the Huberman lab showing that this can actually help improve sleep.
Ooh, I might try that. What else did she recommend?
Things like transcendental meditation, yoga, and holotropic breath work. And she also briefly mentioned that alcohol can really mess with your sleep quality and disrupt important hormones like growth hormone. So, yeah, maybe cut back on the booze.
Good advice. Okay, shifting gears a bit. Let's talk about how hormone levels change over the decades and touch on PCOS.
Sounds good.
So, Dr. Gottfried talked about how important it is to know your baseline hormone levels. Testosterone, estrogen, thyroid hormones, and cortisol. And not just check them once, but keep tabs on them throughout your life.
Yeah, it's like tracking your financial health, but for your hormones.
Totally. And she said if you find out you have high androgens in your teenage years, that can be really important for managing your health long term.
Absolutely. What about testosterone, though? How do those levels typically change as women get older?
That's a good question.
So testosterone can actually start declining as early as your late 20s, and stress can play a role in that. But generally, a good target for healthy testosterone in women after age 25 is to be in the upper half of the normal range.
Good to know. And PCOS, or polycystic ovary syndrome, is something we hear a lot about these days. It's a condition that really involves some big hormone imbalances.
Yeah, it is. And Dr. Gottfried was really clear about this. PCOS is way more than just a reproductive issue. It has some serious long-term risks for heart health and metabolic health, especially after menopause.
So it's something to take seriously, even if you're not planning on getting pregnant.
Absolutely. And she actually criticized the way PCOS is often handled in conventional medicine. They often just focus on whether a woman wants to get pregnant and often just prescribe birth control pills.
Really?
Yeah. She stressed that it's really important to address those underlying hormonal imbalances, and also pointed out that historically, there's been a lack of research funding for women's health issues, which is a problem.
So there's still a lot we don't know.
There is. But what's super interesting is this idea that, all the stress women experience in society, like the pressures of the patriarchy, that stress could actually be contributing to higher androgen levels and PCOS.
Wow, that's pretty profound.
Right. It's a whole new way of thinking about
Hmm.
it. And if that's true, then that could totally change how we approach treatment.
That makes a lot of sense. And she also talked about the role of insulin and glucose, like blood sugar, in certain types of PCOS.
Yeah, in some cases, having high insulin levels can actually push the ovaries to make more testosterone.
Wow. So insulin sensitivity is a big deal, too.
Huge. And speaking of insulin, Dr. Gottfried is a big advocate for continuous glucose monitors,
Mm.
or CGMs. She says they're a game changer for making healthy lifestyle changes.
Oh, CGMs, I've heard about those.
Yeah, they're awesome. They basically give you real-time feedback on how your blood sugar is reacting to what you eat, your stress levels, your sleep, everything.
So it's like personalized data 24/7.
Totally. It puts you in control of your health. And what's really cool is that changes in insulin levels can actually happen years before your glucose levels start to change. So monitoring early on can be incredibly helpful for spotting prediabetes or type 2 diabetes risk.
That's super valuable information. So what are some of the big don'ts for women who want to maximize their vitality and longevity? Like, what should we be avoiding?
All right, here's the list of things Dr. Gottfried says to steer clear of: not getting enough sleep, drinking too much alcohol, having way too much stress, or at least perceiving too much stress, eating a lot of junk food, staying in toxic relationships and being isolated, and not moving your body enough or exercising in a way that doesn't work for you.
That's a pretty comprehensive list, and it's all interconnected, right?
It totally is. You can't separate one thing from the other.
Let's talk a bit more about exercise. What kind of exercise does she recommend?
Well, she said, based on all the research, a good ratio is about 1/3 cardio and 2/3 strength training.
Strength training. Got it. More weights, less treadmill.
Yeah, pretty much. But she also emphasized that it's really important to figure out what works best for you, because everyone's different. For example, if you tend to have higher insulin or glucose levels, you might need to do more exercise to help your body use that energy.
Okay, so listen to your body.
Always. She also mentioned that if you do too much long-duration cardio, like running for hours, without enough strength training, that can actually make your cortisol levels go up, which isn't good. She even shared that she used to overdo it on cardio and it messed up her hormones.
Oh, wow. So it's all about finding that sweet spot.
Totally.
What about supplements? Are there any that can help with cortisol or hormones in general?
Yeah. For cortisol, she talked about ashwagandha and rhodiola rosea as potential options for bringing it down. But she also mentioned that it can be good to cycle ashwagandha, meaning not taking it every day. And rhodiola might work better for some people if they take it later in the day.
Interesting.
Any others? She also mentioned phosphatidylserine, or PS. It can lower cortisol a bit too. But some research suggests that taking lower doses, around 400 milligram, might be more effective. And the best time to take it would be when your cortisol is typically highest.
Good to know. I remember she also talked about these things called flat or inverted cortisol patterns. What are those all about?
Yeah, so those patterns happen when your cortisol levels are low in the morning or high at night, which is the opposite of what they should be.
Mm.
And those patterns have been linked to a bunch of negative stuff like anxiety, depression, even lower survival rates for breast cancer. It can also be connected to things like PTSD, autoimmune conditions, and fibromyalgia.
Yikes.
Yeah, not good. She also said that there can be variations in your genes that affect how your body makes cortisol.
So genetics play a role too?
Always.
What about omega-3s and fish oil? Those seem to be good for everything.
They are super important. But Dr. Gottfried emphasized that everyone's needs are different. She even suggested getting your omega-3 levels tested. There are labs that do that, like Omega Quant or Cleveland Heart Lab.
Okay, I'll have to look into that.
And beyond just fighting inflammation, she talked about how omega-3s help with resolving inflammation, which is really important. And she mentioned these things called SPMs, specialized pro-resolving mediators, which can be beneficial to take along with fish oil.
So fish oil plus SPMs.
Yeah. But if you can't get tested, a good general rule is to aim for about 1,000 milligrams of omega-3s per day.
Mm-hmm.
But of course, getting them from food, like salmon and other fatty fish, is always the best.
Food first. What about other supplements? Which ones does she think are the most beneficial?
Well, she said fish oil, if you're not getting enough from food, is number one. Then magnesium and vitamin D, with the goal of having blood levels between 50 and 90 ng/ml. But she also cautioned against taking supplements you don't actually need.
Right, like don't just take something because it's trendy.
Exactly.
Let's circle back to birth control. We talked about the pill, but what about IUDs? I know Dr. Gottfried has some thoughts on those too.
Yeah, she does. She acknowledged that the pill has been really important for giving women control over their reproduction, and it also significantly reduces the risk of ovarian cancer because it stops you from ovulating as often.
Okay, so fewer periods, lower ovarian cancer risks.
Right. She said taking the pill for about 5 years can cut your risk of ovarian cancer by a whopping 50%, which is amazing.
That's a huge benefit. But she also had some concerns about it, right?
Yeah, she did. She went into detail about some potential risks of the pill, like depleting certain nutrients, like magnesium and B vitamins. There's also a possible negative impact on your gut microbiome, and it might increase your risk of inflammatory bowel disease and autoimmune conditions.
Wow. That's a lot to consider.
It is. And she also said it can increase inflammation throughout your body and make your stress response system less flexible. And there might be some effects on your thyroid function, too.
So many things to think about.
I know, right? And it's not just the direct effects. The way the pill works hormonally can have some pretty big downstream consequences, too.
How so?
Okay, so the synthetic estrogen in the pill makes your body produce more of this protein called sex hormone binding globulin, or SHBG. And this SHBG binds to both estrogen and, importantly, testosterone. So there's less of the free, active forms of those hormones floating around.
Okay, so less free estrogen and testosterone.
And even though we're talking about women's health, testosterone is super important for women too. It's involved in sex drive, building muscle, how well you respond to strength training, and even things like confidence and feeling like you can take charge.
Wait, so the pill can affect all of that?
It can. Lower levels of free testosterone from being on the pill can lead to things like vaginal dryness, less interest in sex, and even feeling less confident.
That's crazy. I never would have connected those things.
It's a lot, right? And this is even a bit alarming, but she mentioned some research that suggests the pill might cause the clitoris to shrink by up to 20% and even cause nerve regression with long-term use.
Whoa, that's serious.
It is. And we don't even really know how well those SHBG levels go back to normal after you stop taking the pill. She also pointed out that in conventional medicine, they often approach hormone testing differently depending on whether a woman is trying to get pregnant or not.
So there's this bias based on whether you want to have kids or not. That's kind of messed up.
It is. It's like they're not considering the whole picture of a woman's health.
Exactly.
And speaking of having kids, what about checking ovarian reserve and AMH levels? Should women be thinking about that earlier in life?
Yeah, what's the deal with that?
So Dr. Gottfried thinks it's definitely valuable to get an idea of how many eggs you have left, which they can check with an ultrasound, and also to measure your AMH levels with a blood test. AMH is a hormone that reflects your ovarian reserve. And she thinks doing this earlier, like in your 20s or 30s, could help you plan for your future fertility.
Makes sense. So you can make more informed choices.
Exactly. But the problem is that these tests usually aren't part of the standard checkups, and they're often only done when someone's already trying to conceive or considering freezing their eggs. And a lot of that is because of the cost.
Right. Those fertility treatments can be super expensive.
They are. But Dr. Gottfried believes that this information should be more widely available to women so they can be proactive about their reproductive health.
I agree. Okay, let's move into menopause and perimenopause. Those are big hormonal transitions for women.
They are. So menopause is officially when you have your last period, usually around age 51 or 52. But before that, there's this phase called perimenopause, where your hormones start to fluctuate and you can have all sorts of symptoms. And that can start years earlier.
Yeah, it can be a really long process.
It can. And Dr. Gottfried talked about the history of hormone replacement therapy, or HRT. After that big Women's Health Initiative study in 2002, a lot of women stopped using HRT, even though it can be really beneficial.
That study kind of scared people off HRT, right?
Yeah, it did. But the thing is, that original study had some flaws. The women in the study were mostly older, they used synthetic hormones, and they were mainly focused on heart health outcomes.
Okay, so it wasn't the most accurate picture of HRT.
Exactly. And more recent research has shown that HRT, when it started within 5 to 10 years of menopause and uses bioidentical hormones, which are more like the ones your body makes naturally, can actually be really safe and helpful for many women. It might even lower the risk of heart problems, improve bone density, and reduce the risk of diabetes.
So it can actually be protective.
It can. But if you start HRT much later, like after age 60, there might be more risks involved.
Okay, good to know.
And she was really passionate about the importance of understanding perimenopause. It can start in your 30s or 40s, and you might notice changes in your cycle, have trouble sleeping, or feel more anxious. She sees it as a really critical window to start paying attention to those hormonal shifts.
Yeah, it's like your body's giving you early warning signs.
Exactly. And what's super fascinating is that your brain undergoes some major changes during perimenopause. Dr. Lisa Mosconi has done some amazing work showing that there's a big drop in brain metabolism during this time. Like, brain scans have shown a decrease of about 20% in how much energy the brain is using.
Wow, 20%, that's a lot.
It is. And some of those classic perimenopausal symptoms like hot flashes, night sweats, and insomnia might actually be connected to this decrease in brain energy.
That's so interesting. So those symptoms are like clues about what's happening in your brain.
Exactly. And researchers are even looking into this in relation to Alzheimer's disease. They're wondering if perimenopause could be an early sign of increased risk.
Wow, that's pretty mind-blowing.
It is. And insulin resistance might also play a role in that decreased brain metabolism. But the main driver seems to be the decline in estrogen.
So estrogen is super important for brain health, too.
It is, and Dr. Gottfried was pretty critical of the way menopause is often handled in conventional medicine, where they only offer HRT for really severe hot flashes or night sweats. She argued that this misses the bigger picture of how HRT can benefit brain health and help prevent disease. She emphasized that hot flashes and night sweats are actually important signals that there are underlying issues with heart health, bone health, and those brain changes we talked about.
It's like they're not just annoying symptoms, they're actually telling us something important.
Exactly. And she also briefly mentioned some other things you can do to help with brain energy and insulin sensitivity during this time, like intermittent fasting or maybe trying a ketogenic diet for a period of time, either alongside HRT or on their own.
So there are options beyond just HRT.
There are. It's all about finding what works for you.
Wow, this has been such a deep dive into female hormone health. It's so clear that it's a really personal journey for every woman.
It is. And the biggest takeaway is that being proactive and really understanding your hormones and your metabolism throughout your life is crucial.
It's like taking control of your health destiny.
Totally.
And I really encourage everyone listening to think about those biomarkers and testing options we talked about and see if they might be helpful for you.
Yeah. And we're definitely planning more deep dives on all sorts of related topics like men's health, perimenopause in more detail, PCOS, contraception, nutrition for hormone health, and even plant-based medicines for well-being.
Lots to explore. And I just want to leave everyone with one final thought, something really important that Dr. Gottfried mentioned. For women and men around age 45, or even sooner if you have any heart disease risk factors, talk to your doctor about getting a coronary artery calcium score, or CAC score. It's a type of CT scan that can give you early insights into your heart health. You can often order it yourself, and it usually costs around $250.
That's great advice.
And for everyone, it's also helpful to figure out your ACE score, which stands for Adverse Childhood Experiences. It basically helps you understand how much stress you experienced in childhood, which can actually have a big impact on your health long term.
So much good information to take away from this deep dive. Thanks for joining us.
Until our next deep dive together.